student nurses. Our drug for this episode is hydrochlorothiazide. Hydrochlorothiazide is a thiazide diuretic. It is the brand names of apohydro, hydrodiuryl, microzide, and novohydrazide. Hydrochlorothiazide is indicated for the treatment of mid to moderate hypertension, edema in CHF, and nephrotic syndrome. It is also used as a treatment of lithium-induced diabetes insipidus. Its mechanism of action is it blocks reabsorption of water, sodium, and potassium at cortical diluting segment of the distal tubule in the kidney, reducing the volume of plasma and extracellular fluid, and also directly affect the peripheral resistance of blood vessels, thus promoting diuresis and reducing blood pressure. It is rapidly absorbed in the GI tissue, metabolized in the liver with a half-life of 5.6 to 14.8 hours, and is excreted in the urine. To ensure patient safety, here are the must-to-know informations. The following are contraindications for the use of hydrochlorothiazide: anorrhea, history of hypersensitivity to sulfonamides or thiazide diuretics, and renal decompensation. Also, it is used in caution in patients with severe renal disease, hepatic impairment, diabetes mellitus, elderly patients, patients with gout, moderate to high cholesterol, high triglycerides, and hypercalcemia. Now, let's go to the normal side effects of hydrochlorothiazide, and there is no need to report to the doctor for these symptoms. For the expected side effects is increased urinary frequency and urinary volume. For frequent use is potassium depletion, and for occasional use is orthostatic hypotension, headache, GI disturbances, and photosensitivity.
For the need to report symptoms or the adverse effects are: vigorous diuresis may lead to profound water loss or electrolyte depletion, resulting in hypokalemia, hyponatremia, and dehydration. Acute hypotensive episodes may occur. Hypoglycemia may occur during prolonged therapy. Pancreatitis, blood dyscrasias, pulmonary edema, allergic pneumonitis, dermatologic reactions, and lastly, overdose can lead to lethargy and coma without changes in electrolytes or hydration. And the last but definitely not the least is the nursing responsibilities before, during, and after administration of hydrochlorothiazide. First is ask patient for history of allergies to hydrochlorothiazide and history of any disease listed in the contraindication and caution list. Next is conduct physical assessment to gather baseline data. And lastly, perform patient or family teaching on the following. Expect increased frequency or volume of urination. To reduce hypotensive effect, rise slowly from lying to sitting position and permit legs to dangle momentarily before standing. Eat foods high in potassium such as whole grains, legumes, meat, bananas, apricots, orange juice, potatoes, maybe white or sweet, and raisins. And lastly, protect skin from sun and ultraviolet rays because photosensitivity may occur. During administration of hydrochlorothiazide, a nurse should observe the rites of administration. And lastly, after administration, document the data and monitor and evaluate patient, especially for adverse effects. That's it for hydrochlorothiazide. Hope you learned something and see you on our next episodes.